Hello and welcome. It's so nice to see all of you. Thank you so much for coming. I'm Susan Katz. If you don't know me, this is my class. This is the final presentation of the Publicity Methods class. I'd like to thank our wonderful client, UB Clinics, who we worked with very closely this semester. 3 people I must recognize because we drove them nuts. The Vice President of Health Sciences and Director of the Nutrition Institute, Dr. Dave Brady, Clinical Services Administrator, Tammy Margion, and Health Science Coordinator, Janice Fay. Thank you so much. A lot of people are joining us today from Health Sciences, and we really appreciate your coming. We'd also like to thank very much the College of Public and International Affairs. Dean Ward, unfortunately, was ill, and he just let us know he couldn't come. But in his place is the person who positively runs everything at the College of Public and International Affairs, Professor Guljana Torkai. Thank you so much for coming. Also joining us is somebody very special, Professor Peter Van Geldern, who's also videotaping our presentation today. We worked very closely with him in the production of the video that you'll see in a couple of minutes. So anyway, when this class meets, we always select a nonprofit client from the greater Bridgeport area, and we produce a high-end, full-up multimedia campaign for them. So what was our goal with UB Clinics? Well, the goal was to increase awareness in the Bridgeport region and beyond, and to increase awareness right here on the UB campus among both faculty and students. So what was the hook? Well, the hook was holistic healthcare at low cost, no insurance needed. So whether you need naturopathic, chiropractic, acupuncture, or dental hygiene, you get professional service all in one wonderful clinic in a beautiful seaside locale. So the way this class operates is we work as one agency, and we're divided into 4 departments: press and public relations, art and design, social media, and video and photography. So let's kick it off. Let's take a look at the new campaign for the UB Clinics, starting off with meeting the members of our agency first, beginning with the Department of Press and Public Relations.
Good afternoon, everyone. My name is Nicholas Velasquez.
I'm Ashley Castellano, and we're the co-chairs of Press and Public Relations, and this is our team.
Hello, my name is Manju Zafar.
Hi, I'm Justin Noel.
Hello, I'm Josephine Quesco.
Art and design.
Good afternoon. My name is Nicholas Mancheno, and I'm the chair of art and design. This is my team.
Hi, I'm Jordan Fraser.
Hi, I'm Amy Murphy.
Hi, I'm Yaron Ding.
Hi, I'm Hannah Am.
Hello, I'm Sean Walsh.
In social media.
Hi, my name is Tiara Avahart. I'm Ashley Castellano, and we're the co-chairs of social media. This is our team.
Hi, I'm Tatiana Diaz.
Hi, I'm Stephanie Hernandez.
Hi, I'm Jada Superville.
And video and photography.
Hello, everybody. I'm Bree Jackson. I was the chair of video and photography, and this is my team.
Hello, I'm Control Thompson-Nicky.
Hello, my name is Kashonda Henry.
Hello again. I'm Ashley Castellano, co-chair of Press and Public Relations. This is my team member, Madji. So right here we have the media kit for you, which is also known as the press kit. It has a lot of copy in it and everything that we did today, so make sure you follow along because this is your guidebook to our campaign. We have traditional media in here, and also we have digital files on a flash drive. So right here you can see your old brochure. It's very copy heavy and it's not a lot of pictures, and the problem with that is that a lot of people nowadays are visual. They want to see pictures, they want something that will draw them in. So we decided to redesign it. We made it a gatefold. So it's 9x16 open and 4x9 closed. Nick Mancheno is the one who designed it, and the Press and Public Relations team are the ones who wrote everything that you need to know, whether it's about the 4 distinctive clinics or the comprehensive care. To Took Nick multiple passes, but we believe that this is the best one for UB clinics because it shows diversity and everything that UB clinics is about. It's visually appealing, and the best part about it is that it maintains the aspects of UB branding guides, so you guys can use it and not get in trouble for it.
Very important.
Yeah. It's clear as possible, and it draws people in. And it's usable, and you can put it into use right away, whether you want to do it tomorrow or in a couple weeks. It's up to you. And now Matthew will talk about the fact sheet, meet the team, and the history of UB clinics.
In any media kit, you'll find a history and background sheet, which is a very important piece of collateral. It basically prioritizes everything that's going on in the clinic and what's it about and its mission. And it also talks about the 4 main clinics under UB clinics: the naturopathic, acupuncture, chiropractic, and the dental hygiene clinic. The UB clinic's main mission is to offer both the Bridgeport and UB communities with cost-efficient and accessible healthcare. We all know that. We also have a fact sheet. We have the traditional fact sheet that you can find in any media, and we also have an infographic fact sheet, which was designed by Ashley for online media and the web. And on any fact sheet, you'll find facts such as the acupuncture clinic blends together state-of-the-art clinical training and traditional Chinese medicine, and the chiropractic clinic includes a number of practices such as spinal adjustments, lifestyle counseling, and soft tissue therapy, so go get them. We also have meet the team pieces that are also very important in a present PR kit. We have 7 featured members that we decided to talk about, but right now we have 3 on the board: Dr. David M. Brady, Cami Marjon, and Dr. Michael Kaufman. And now we'll have Kashana talk about our brand journalism story.
Hello. Okay, so the main question we all have here is, what is brand journalism? Now, brand journalism is a type of journalism that is a storytelling that helps with the brand or a company, because you never want to overpower the brand or company in the article. So as you can see here, we have 2 examples of our very own articles that was written by, one here is how visiting the chiropractor is better than using antibiotics, and that was written by our very own Jada Superville. She's a writer for the UB Clinics, and that was actually put in a spread in Natural Nutmeg. Then we have another article of brand journalism that was written by myself. The article is on how acupuncture improves sleep, and this was actually in Natural Awakenings. In both of these articles, you can find a copy in your media kit. Next, we have a feature story, and this feature story is about Laura Gecko, who helped with getting the UB clinics to the striving success that it is today. And that's our feature story that was written by Justin Noel, who's on our PR team. And now we have our very own multimedia news release. Now, multimedia, with the UB clinics, we wanted to keep that idea of keeping it modern. What's more modern than media than this? So in this, the article is actually about how the UB clinics is working with our UB clinics Publicity Methods team with the campaign. And on it, you can find downloadable photos, our Twitter feed, our UB clinics share links, and this article was at the very end. You can see we have a boilerplate, which puts in about what the UB clinics is in the 4 areas of healthcare that it features in, and this was written by our very own Ashley Castellano. And now, we will be listening to our 1-minute radio spot, which is UB Health, your partners of health and wellness. Thank you.
Do worries about your family's health keep you up at night? Are you afraid to visit a doctor due to high costs? Then check out the UB Clinics in Bridgeport today. At UB Clinics, you can receive preventive care at low cost, no insurance needed. Not sure what you need? Visit our clinics on Mondays 9 a.m. to noon for a free and personalized assessment. Supervised student interns will find the best plan of care for you within our 4 distinctive and unique clinics that include naturopathic, chiropractic, acupuncture, and dental hygiene. If you're ready for a new perspective and want to feel like yourself again, call 203-576-4349 for an appointment. UB Clinics, holistic healthcare at low cost, no insurance needed. UB Clinics, your partners in health and wellness. Call us 203-576-4349.
And because credit is always important, this was written by our very own Ashley Castellano, and the music was by Cottrell Thompson-Nicky. Thank you.
Hi guys, I'm Lani Akingade, and today I'm going to be representing art and design. Okay, so the first piece that we're going to be showing you today are the promotional flyers. As you can see over here, Ashley has the old ones. They were a bit text heavy, and we felt like they kind of didn't match up with one another. So one thing that we wanted to do with these new ones, we wanted to make sure that they were able to stand together as well as stand on their own. If you guys have a media kit, you guys can see inside that we did include the flyers. A lot of it is less wordy, less text heavy, and it gets to the point. And one main thing that we wanted to emphasize on all of them was the idea of low cost and no insurance needed. So there are 4 different ones for all of the different clinical areas, and we just, once again, we wanted to make sure that the message was getting across without people with people knowing the message right away, knowing it immediately, and kind of knowing what they wanted to do with it. Following the promotional flyers, we have the magazine ads. On the screen here, we have a quarter ad and a half-page ad, and they would fit in the 3 different types of magazines. And if you guys notice here, they're all basically the same. It says holistic healthcare at a low cost. So one thing, again, we wanted to make sure we were emphasizing was uniformity. We wanted to make sure they all look the same. They kind of went with each other, so any client or anything like that would know the UB Clinics, and they would know where they're going and who this is and what we stand for. Following this one, we do have posters. These were done by Jordan Frazier, and for the purpose of this, they can be indoor, but for the purpose of this, we did use it for outdoor media. And on the screen, you could just see that it says naturopathic pediatric wellness care, and then along with the UB Clinics logo at the bottom, and then the phone number that they could call. We felt like this was important, and this was well executed because people are often passing by, so they could just know what the clinics are about, know where it is, and make their first appointment for themselves. Following this, we have a billboard that was done by Nick Mancheno. And on the screen, again, it just says holistic healthcare at a low cost, and then it just says bridgeport.edu/UB Clinics, along with the phone number and then the location. We felt like this was really important just because we know with billboards, people are often driving past. So they don't really have time to read really wordy or anything that is really wordy. So we wanted to keep it short and sweet, and we felt like this got to the point because they know that it's holistic healthcare at a low cost. They know that this is what they're looking for, and they're more likely and more inclined to visit UB Clinics. And it just has the phone number, again, and the address. Following this one, we have the subway kiosk. This one is a little more wordy than the other ones just because we know when people are passing through and when they're traveling from place to place, they have more time to read, just going through the subways or anything like that. And this one just says your partners in health and wellness. And then it says our clinic provides distinctive services along with a few other things. And then it just, at the bottom, if you guys notice, it says low cost and no insurance needed. Because this is important for people. Not everybody has insurance, and not everybody wants to spend an arm and a leg when they want to take care of their health. So we felt like this got to the point, and this will make people, once again, more inclined to visit the UB Clinics. Following this one, we have bus collateral. The first advertisement is just the back of the bus, and it says holistic healthcare at low cost, along with the address that they could hear more about UB Clinics, and then the logo of UB Clinics. And then this one on the side just says, again, your partners in health and wellness. It just has a little more text than the other ones do because we felt like people are going to be stopping, they have the time to read. So for advertisements that we felt they would have the time to actually read and go in depth into, we wanted to kind of make the text a little more just so they could learn more about it before actually getting there, as opposed to this one. It does have the website where they can learn more about the UB Clinics. Following this, we have the event schematic. This was done by Amy Murphy, and you can see it over there. It's just about around the same size as if you were to use it for different events. And then we had a mock-up of how the booth would look like because we felt like this would attract people. They want to know about the UB Clinics, whether it's them going there, whether it's them working at the UB Clinics. But we felt like
this kind of captivated people's attention, especially with something as large as this. They're able to see it from afar, and they're more inclined to come to the booth and learn about the UB clinics and how they can take care of their health. Okay, following this, we have our logo proposals. Unfortunately, we didn't get to change the logo this time around due to a little budget errors and things like that. However, we did have examples that Nick Mancheno actually made of the different kind of logos that the UB clinics could have changed to, or anything like this. And then the comment just says, in all 3 versions, the goal was to create a clearer and more modern visual symbol of the stethoscope by incorporating it within the shape of the U. That way, the UB could act alone, or it could work with other things. And we felt like this was a more modern take on the original logo that it is right now. And this is just an idea for maybe a future plan to renovate UB clinics again. Okay, and now we will bring you to our 30-second radio spot. The words were done by Nick Velasquez, and the music was done by Cottrell Thompson-Nicky.
Are you looking for holistic healthcare at affordable rates? Come to UB Clinics on the University of Bridgeport campus. Acupuncture, chiropractic, naturopathic, and dental hygiene. We'll complete a full health assessment and design a personalized plan of care for you. To schedule an appointment, call 203-576-4349. That's 203-576-4349.
Hello again, it's Ashley, co-chair of social media. So social media is very important to today's society. How many of you guys have been on social media in the last 24 hours? We're all addicted to it, so it's the best part for free publicity for every campaign. So you can do anything on social media nowadays. You can do polls about what do you think the best clinic is, or you can even do events so everyone can see what you guys are up to. The best part about social media is you can get instant feedback. So if you post something, someone can say, oh, that's great, I wish I could go, but unfortunately I'm doing this. And I mean, who doesn't love instant feedback? So right now we did Facebook, Twitter, and YouTube banners for you. We posted ideas of what you guys could post. You could either copy it or use it as a general guideline. The Facebook posts were written by Jada Superville. The banner right here is made by Tatiana Diaz, and she used hashtags, and she'll explain further why hashtags are important to social media. One of the posts that Jada Superville wrote was, not sure how to relieve a certain pain? UB Clinic College of Chiropractic offers consultation for both University of Bridgeport students and the public. You can take a trip there or call the number to make an appointment today. Hashtag UB Clinics. And then you can also see that we updated the cover photo, and it will share on everyone's timeline once you make any changes to your site. And we also made an event, which is important for Facebook. Next we have Twitter. We revamped it with a new banner, new icon, and we put a tweet there. The tweet was written. One of the tweets were written by Lonnie, and it says, "No insurance, no problem. Stop by UB Clinics and explore the many possibilities the clinics has to offer. Located on 60 Lafayette Street on Bridgeport, Connecticut. Hashtag UB Clinics." We also wanted to use photos because, once again, people are visual. We want to draw them in and make sure that they understand your message and what you're trying to say. And lastly, we have our YouTube. Right now, you only have a video of Dr. Brady on your University of Bridgeport YouTube, but that doesn't mean that you guys can't make your own YouTube page. Make it about UB Clinics. Talk about the distinctive clinics that you have, what you have to offer, how your events went, and the possibilities are endless. So now I will introduce my co-chair, Tara Aberhart, and our team member, Tatiana Diaz.
So our social media team came up with hashtags that you all can use for your social media pages. For those of you that are not aware of what a hashtag is, it's a word or phrase preceded by a hash or pound sign, and it's used to identify messages on a specific topic. Hashtags are important to use because they help increase social media engagement with new users. And in your media kit, you guys will be able to see the hashtags that we came up with. Okay, so like the people before me said, social media is extremely important. Therefore, Jada and I came up with a bunch of different strategies that the clinic can use to increase their recognition and their number of potential appointments from students, faculty, residents, and visitors of Bridgeport. So our social media strategy as displayed, this is the more wordy version of it. We also have an infographic. Both of those are in your media kit. The idea of it was pretty much to revamp the social media as well as push hashtags like Tatiana said, to create buzz and to answer questions online using live features on Instagram and Facebook. We realized pretty early on that this would most likely be a challenge for the clinic just because of the fact that there's kind of no one there to work on this 24/7, and social media is something that kind of needs to be worked on 24/7. But like I said, please look in your media kit just so that you can see our vision in full fold. Here we have the infographic with 3 different steps that Jada and I came up with. Step 1 is to revamp social media accounts, as I said. Step 2 is to create buzz, and step 3 is increase appointments. So step 1 and 2 obviously will create step 3. And now we will be hearing from Krishanda again.
Can't seem to get enough of me today, huh? Okay, so when you first came in, everyone should have received one of these papers. It is for the Zapper code, and I have a team, and we will be demonstrating on how to use the Zapper code. So my team, Tiara, Tati, Ashley, Nick, Maggie, Stephanie, Justin, and Josephine. We will all be downloading the app. We all should have downloaded the app, and we will be showing you how to use this. With this app, we decided to keep, because we wanted to keep the UB clinics modern and multimedia, we used augmented reality. Now, augmented reality is a direct or indirect view of the real world and what's going on. So, as you can see, this, and you can kind of get like a quick view of like what's going on in the app.
Don't download that app.
Number?
Hello again, everybody. A video is an important part of a media campaign nowadays because people don't always want to read and they can't always remember what they have read. So it's important to have that option, and also it provides a human touch to your media campaign. So some problems we noticed with the older videos currently on the website is that they haven't been updated in a while, and they're also 10 minutes long, so nobody's watching all of that. So we wanted to provide a more modern, updated version of a promo video that can be used on television, online. It is 6 minutes, so you can't use it on social media. There's bits and pieces if you chopped it up that maybe like a 30-second spot could be on Twitter if you decide to become more active on social media. Some problems we faced were, oh my gosh, media management, lost files, scheduling errors. We had a few issues, but we just want to say thank you to each and every intern, staff member, clinician, all of you guys for working with us and being so flexible with us and reshooting with us and taking long drives out of your day to be with us. We appreciate it. So also special shout out to Professor Geldern for helping with equipment and editing and staying up all night with us. Without further ado, here's your promo video.
Welcome to UB Clinics, where you'll get comprehensive and personalized holistic healthcare at low cost, no insurance needed. Patients from all over are served by our 4 distinctive and unique clinics, focused on getting and keeping you healthy.
Hi, my name is Cami Margione, and I'm the Clinic Service Administrator here at the University of Bridgeport for the UB Clinic. Well, I oversee all the disciplines here in the UB Clinic network, so between all of our clinics, naturopathic, dental hygiene, chiropractic, and acupuncture, we service the underinsured, no insured patients in the community. We'll go out to health fairs and schools and health food stores just to promote our services so patients know what we do here and what services that we offer where they may not get, outside of our UB Clinic network.
The Phone's Dental Hygienic Clinic helps patients eliminate and prevent oral disease and maintain overall oral health.
Our dental hygiene program, it has a clinic on campus as well as one in the Tisdale Elementary School. We provide preventive care here in the clinic and in the elementary school, and we also go out into the community to provide educational programs for students in the schools, for alcohol and drug education facilities, also for long-term facilities, special needs for children with disabilities, emotional concerns, physical disabilities. Our students will visit with senior centers, and they have a big presence when there are health fairs. They will take part in that both here on campus as well as out in the community.
Our naturopathic medical clinic offers team-based medical care with a focus on patient education and the use of natural and preventative diagnostics and therapeutics.
I'm Dr. Prenguber. I'm the Dean of the College of Naturopathic Medicine, one of the programs that is part of the UB Clinics. We provide services to the local community and most especially to those people who are looking for a more holistic approach to their health care. Sometimes people who are underserved. We see those in different ways, but generally people who are looking for ways that will support their health that's less toxic, non-invasive approaches to health. We can do so much with things as simple as exercise and diet to address so many different health issues for people these days.
Our chiropractic clinic offers a drugless and non-surgical approach to healthcare. We offer routine exams, sports exams, chiropractic physical medicine, rehabilitation, and lifestyle and nutrition counseling.
My name is Dr. Michael Chofi. I'm Dean of the College of Chiropractic, University of Bridgeport. And the last 2 semesters or last year of the program, our students have to complete their clinical requirements within UB Clinics. Patients have to know that it is a teaching clinic, and there are some advantages to being a teaching clinic. Teaching clinic has the advantage that all of the clinicians that are on staff are well up to date with the current research, as well as the students. And the second thing is, there is no real pressure or time limit for your patient encounter like there would be at an office where usually it's rigidly scheduled. In essence, then each patient is given the amount of time that is needed for their care.
The acupuncture clinic offers acupuncture and traditional Chinese medicine methods with state-of-the-art clinical training facilities.
Hi, my name is Dr. Jennifer Brett. I'm the director of the Acupuncture Institute here at the University of Bridgeport. The Acupuncture Institute holds outreach clinics where we treat low-income patients at downtown Bridgeport for no cost. We also have outreach clinics in Wilton and in West Haven. In some sense, acupuncture is more traditional than what we think of as conventional medicine. Acupuncture has been around for well over 2,000 years, so Chinese medicine has helped more patients get better than all other forms of medicine combined. In modern times, acupuncture provides care for people who can't get better from other methods. It can reduce the need for surgeries, reduce the need for pain medication, help people with chronic complaints, from menstrual cramps and irritable bowel syndrome to chronic headaches, not have those problems on a regular basis.
Are you looking for a holistic assessment and preventative care? We also offer an integrative clinic where clinicians and interns from various fields and approaches collaboratively assess your medical problems from every angle. Our staff then develops a plan specifically personalized for you, using the most appropriate treatment options.
So all of the programs that train people to be specific health providers here at UB, they're part of the mission of that program is to serve the community. We hope in the end that people take away from the experience in the UB clinics that they were dealt with respectfully, with a lot of compassion, in a very personalized way, that everyone who they saw was really concerned with their best interest in helping them with whatever health challenge they may have, and attaining a higher level of health, vitality, and wellness going forward.
The UB Clinics. Comprehensive and personalized holistic healthcare at low cost. No insurance needed. The UB Clinics, 60 Lafayette Street in Bridgeport, Connecticut. Call 203-576-4349 and schedule an appointment today.
and that's the new campaign for the UB clinics. There's two people I want to cite from our class. First, the person standing behind me the entire time. This is the assistant creative director. This is Lonnie Akinbada. And Akinbadi, thank you. And the fabulous, wonderful Nick Moncheno, who's the director of art, who refuses to get up and talk, but he's so fabulous. Thank you so much, Nick. We now would like to turn this over to the UB clinics for your comments, please.
Nonetheless.
Sorry, I speak so loud, I don't know the difference. You know what it is?
I can too. If you...
Yeah, I know.
There
You're
we
like
go.
me. Yeah.
There you go.
I didn't even
Start spreading. Anyway, I wanted to thank all of the people in Dr. Katz's class and Dr. Katz. I didn't know we were going to have a coordinated sort of choreography as you guys passed through on center and handed off the mic, and you were all dressed the same. We had live music from a member in the class, so all that is added bonuses. But it's been a pleasure working with all of you. I know it was quite a project and quite a task. I'd like to thank Cammie and Janice in particular for carrying the message of the UB clinics to all of you so you can understand it better, so that you can create this wonderful campaign for us. All of the folks in the clinic who took time in their busy schedule to get videotaped and photographed and everything else, I also wanted to thank you. We really look forward to being able to use this material to extend our reach into the greater Bridgeport community. A big part of our mission here is to deliver healthcare services to people who most need it in our community. And we deliver the kind of upstream preventive healthcare that many of these folks who use our clinics would otherwise not have access to, because either they don't have insurance to cover it or they don't have the financial means to go acquire it on their own. So it's a really important part of the university's mission and the mission of all of our health science programs that have clinics. I think this is going to really help us up our game, be able to get the message out about the clinics in a more effective, more modern, more slick way, if you will. You guys are younger than all of us who are over there operating the clinics, and you understand how to message to the community at a far greater and effective level than we could ever figure out ourselves. So thank you for doing all this. We really appreciate your effort, and you guys did a great job. And I'll let Cammie and Janice say a few words too. Come on.
No.
She can go.
Katz, you have to get out. My students didn't want to speak, so you have to.
I'll stand with you. I want to thank everybody in the class. You did a tremendous job. Working with the healthcare market is a very different industry. You took the time to listen to all of us and to learn about it, and we've learned a lot from you. And I want to thank you.
I have got to thank you all so much. I know I drove some of you guys crazy, like retake. I don't like it, let's do it over. You know, you guys did a wonderful job, and kudos to you. Thanks for coming over so many times to the clinic, you know, calling me and saying, Cammie, I gotta come over, we missed this, we gotta get this. We really worked well together, and I wish you all the best of luck, and I thank you so much for all your hard work.
Thank you. We'd like to ask anybody from the UB clinics if you have any comments. I can come around. Anybody have a comment? Nothing? Oh, come on. Thank you.
Good hearing.
Great job, everyone. I thoroughly enjoyed this. One question I have is about the process you went through. I noticed that the kind of the hook was low cost, no insurance, but you used the word holistic in a lot of your messaging, and I'm just wondering, how much conversation you had, how much thinking you did as far as whether that word is understood by the community that you're trying to reach, and how you communicate what that word means in a visual or limited text space.
I think that's always been an issue that they've had. Dr. Brady explained to us that holistic is a word probably that people who are seeking these kind of services understand, so that would be a good generic kind of overview word that we could use. Would you concur with that, or?
Yeah, it is a challenge. I think you nailed it in how we message this, because we have to be careful not to use the language that we understand within our professions and use language that the public understands. So we tend to use words like integrative, functional, even the word naturopathic, for instance, maybe is not well understood by the general public, but even though holistic is not perfect, it's probably the word that best describes our overarching philosophy there, that most would be best understood of all the different choices. It's certainly not perfect, and that's always been a challenge of our educational campaign. How are the UB clinics different than a million other clinics around, right? And it's really the collection or palette of services that we offer is very different. So that was what we went with. It'll be effective, maybe. We'll have to see. We'll find out.
I wanted to ask just Professor Van Geldern to make a comment because he worked so hard with us, Professor.
See if I can film myself. Yeah, so actually what I thought was... Got it? There we go. So yeah, I made an interesting analogy to being a teaching clinic. You have students and professionals in the same space, and I know that Professor Katz and I are trying to achieve that same thing. So you can see running a program like a creative agency gives the opportunity to deliver professional stuff, but a creative teaching environment. And so you probably know the challenges that go with that. We have those same challenges, but it's been rewarding for us, and I'm so proud of all the kids, and we definitely had some bumpy roads, but we're kind of used to that production. We got thick skin because every production's intense, but the idea is really try to nail what the client is all about and then communicate that. So hopefully we can all be awesome mass communicators when we graduate, right guys? Thanks again.
Does anyone else want to comment? If not,
Y'all did a fabulous job.
oh, thank you. You're so right. Thank you.
I second that. You did an amazing job. Thank you for all your hard work and this great quality product. I look forward to helping getting the word out there. There's a lot of people who don't know who we are in the community, and that's one of our main goals, to contribute to the community in every way we can. And healthcare is our thing, so definitely this is the way to do it. More than a comment, I had a question. How can we and let's say the student body or the general UB community help disseminate this? Or is this something that you guys, your team, will take care of?
No, we're done. This class is 15 weeks. This class is 15 weeks and we're finished. However, we have provided media kits, which we were touting. It's just we couldn't give them out to everybody because they cost a fortune to make. So in the media kit, we have included our collateral. Also, we've outlined, there's plans in there for social media, what to do. Our suggestion to UB clinics.
You just scan, it will save it. You can scan it. Yeah. As long as you just scan it, it'll remember it. But once we re-download it, someone will have to re-download it. It'll be under the social media flyer.
I didn't even know it was in that.
Very impressive.
I usually say everything.
They did it. Same with broadcast television, same.